Okay, I'm going to pick up where I left off. So we left off at erectile dysfunction drugs. And let's look at the next topic, which is a prostatectomy. With some severe cases where there's such damage to the prostate because of cancer, usually, we can go in and remove the prostate gland. That's a prostatectomy. There are different approaches. So suprapubic prostatectomy, where they go in right at the pubis symphysis. There is a retropubic prostatectomy, and you can see the incisional sites here. And they can go in through the perineum and do a prostatectomy, which is the taint. Okay. There's always a risk for bleeding and pain and knowledge deficiency and anxiety when it comes to prostate surgery. And you're always going to encourage fluids, have them not lift anything greater than 5 pounds, avoid constipation, like take a stool softener, stay away from anything that would make them bleed more, like aspirin or NSAIDs, or especially herbals. Okay. And then they may have pain because of bladder spasms. So we can irrigate their catheter as necessary and give them analgesics or antispasmodics and teach them relaxation or deep breathing to help with that. And also men can do Kegels, where they tighten the muscles of the pelvic floor. So when they're peeing, they can actually stop the flow, start the flow, stop the flow, start the flow. Just like women can do Kegels, so can men. Okay, very important to know. So no heavy lifting, like I said, nothing over 5 pounds, stay away from stairs, no driving. This is about 6 weeks after the surgery. No strenuous exercise, no straining, no sex, nothing as far as meds that could make them bleed, and report any signs of infection, or of course, if there's an increase in bleeding, that would be worrisome. Okay. Let's see, prostate cancer. So prostate cancer, risk factors for prostate cancer. Men over 65, high levels of testosterone. So for all these guys that are taking testosterone replacement therapy, that's a warning. Diets that are high in fat are risk factors. Of course, if there's a family history, and occupational exposure to things that are carcinogenic, like asbestos, those types of things. Any of those things can be a risk factor for prostate cancer. And sadly, signs and symptoms are rare in the early stages, but as the cancer progresses, urinary obstruction, blood in the urine, hematuria, urinary retention, and then when it's very far advanced and metastasizes, stage 4 cancer, they can have bone pain, anemia, weakness, weight loss, and it's usually terminal at that point. How do we test them? Again, back to the same old thing, digital rectal exam, always fun, and the PSA, prostate specific antigen. So how do we treat prostate cancer? If we catch it in the early stages, we actually give medications to suppress testosterone. Testosterone is the male sex hormone, and it feeds male sexual organ cancers. Well, that makes sense, doesn't it? Just like estrogen fuels female reproductive cancers like ovarian cancer and breast cancer and cervical cancer, testosterone fuels the male reproductive cancers, including the prostate. So we'll suppress their testosterone. In later stages, we may have to do a prostatectomy and or radiation. And if it's metastasized, in other words, if it's spread outside of the prostate, then some of the options are an orchiectomy, where we would remove the testicles and the prostate with estrogen therapy, chemotherapy, radiation, and of course, a radical prostatectomy, where we remove the prostate gland and any lymph nodes that are around it. Some other disorders of the penis. Peyronie disease is a abnormally curved penis. There are fibrous bands in it that kind of make it tight and make it curve in a weird angle. Priapism is fun. That is a prolonged and painful erection that won't go away. I've seen one case of this where the gentleman had an erection for about 6 hours and then finally came to the ER. It was very painful to watch because the doctor had to do a needle aspiration and get some of the blood out of the penis because to release that erection. And then the fun thing of all is phimosis or paraphimosis. For gentlemen who are not circumcised and they still have foreskin, that has to be kept clean. As they get older, sometimes what'll happen is they will get forgetful and they won't clean it as well. And there's something called smegma that's kind of a secretion that is built up in that foreskin, and it can get so bad and so sticky that the smegma actually glues the foreskin shut so that they cannot urinate. That is a surgical intervention. We've got to go in and cut open the foreskin to be able to have them urinate. Not fun, and it doesn't smell great either. I'm just going to tell you, smells pretty bad. Breast cancer, not a common thing, but men that are uncircumcised or that have had HPV are at risk. And, for cancer is cancer. Therapeutic interventions are going to be either surgery. No, we don't chop off the penis usually, but sometimes we'd have to resect it. In other words, maybe take a portion of it. Radiation and chemotherapy, not a fun topic at all. Testicular disorders, so disorders of the testes. Cryptorchidism, undescended testes, where the testes are still up in the body and they have an empty scrotum. Hydrocele is fluid in the scrotal sac. A variocele is varicose veins of the scrotum. And then there's epididymitis and orchitis, which epididymitis, inflammation of the epididymis, and orchitis is testicular inflammation or infection. Okay. Testicular cancer. So they can get prostate cancer, they can get penile cancer, they can get testicular cancer. Risk factors are cryptorchidism, which is the undescended testicles. Family history runs in families. DES, diethylstilbestrol, use by the mother. We don't see that drug anymore because it was so dangerous. So white guys have a higher risk and higher socioeconomic status. So even your money cannot save you. Okay. These are all risk factors for testicular cancer. Men should be taught to do testicular self-examinations because in the early stages, and cancer is always best if you catch it early, they should be able to palpate both of their testes within the scrotal sac. If they feel a lump that does not cause pain, they need to go to the doctor immediately because that is an early sign of testicular cancer. What do we do for testicular cancer and for prostate cancer? Radiation therapy is one of the big ones, and we use implanted radioactive seeds, they are called. What is that, you ask? Well, they're these little itty bitty things that are filled with radioactive material, and you can see they're next to a penny, so you can see how little they are. This shows you the implanted seeds because they're glowing, because they're radioactive. Okay. So we literally go in and implant these radioactive seeds into the patient and just kind of leave them in there in the hopes that they will shrink the cancer. Okay. This is the implantation method of the radioactive seeds, radioisotopes. The seeds go inside and they kind of sit in the prostate and hopefully shrink the cancer. Okay. Now there's some things to know about this though. When the patient has internal radiation, the patient's radioactive. Okay. They have to be kept in an isolation room. They can't have any visitors for usually the first 72 hours. Definitely no children and no pregnant women. In the room, there will be a box made of lead. So any of their garments or anything that they've touched, their sheets, their blankets, their gown, what have you, go into the lead box because their clothing is radioactive. Okay. Nurses are only permitted in the room for a very brief period of time because radioactivity can cure cancer, shrink it, but it can also cause it. Right. So, and the patient now is radioactive and all of his body fluids are radioactive. So in other words, his semen, his urine, his feces are all radioactive. So you don't want to be handling them. Usually you'll have lead tongs, and let me add that here. That's something else that would be available in the room. Lead tongs to pick things up. You don't want to pick them up with your hands because gloves aren't going to block it. The only thing that can block radioactivity is lead. That is it. Just lead. You know how they'll put a lead apron on you if you're getting x-rays of your mouth, of your teeth? That's to protect your organs from that radiation because radiation can be dangerous. So better to prevent than to fix. Teach men how to do testicular self-examinations. The board may ask about this and breast self-examination. Men should do it every month. They should do it when they're in the shower. They should, soap up the scrotum, and then palpate each testicle right and left. Feel for any lumps or bumps or swelling or anything unusual. Okay. If they do have testicular cancer and they're going to get radiation or chemo, it can make them infertile. In other words, it can make them unable to have children. So before treatment starts, the doctor will talk to the patient about donating sperm, not donating it, but freezing his sperm in a sperm bank so that if he ever wants to have children down the road, he can. And then a vasectomy. Okay. It's permanent birth control. It's effective anywhere from 1 to 3 months after the procedure. It's a very minimal procedure. It's done outpatient. It's so easy. It's hysterical. But they have to go back right after the procedure within a month to make sure that there are no sperms still coming through. What they do is they go to the vas deferens, which is where the sperm go into the semen, and they interrupt it. They kind of cut it, right, and cauterize it. So it's very effective, right? It works, but you have to don't make sure that you are sperm free before you start having unprotected sex. And this is kind of a depiction of what they do. It's a teeny tiny little incision. I mean, teeny tiny. They pull the vas deferens through the incision. They cut it. They suture the ends of it. They stick it back in and suture the incision. And it's literally tiny. Okay. It's outpatient. They go in the morning and they're out by noon. Erectile dysfunction. We'll talk about this briefly. That's problems obtaining or maintaining an erection. And it can be physical or psychological. So things like stress, illness, fatigue, and the use of alcohol and drugs, or things like, hormone imbalances or, depression, obstructive sleep apnea, those kinds of things. All of those can affect that. Usually there will be a full evaluation, blood tests, checking for testosterone levels, et cetera. But there's something that we can do. We have pills for that. So sildenafil, which is Viagra, tadalafil, Cialis, and vardenafil, which is Levitra. These are the 3 erection pills, okay? Most men can take them. It's important for me to note that most blood pressure meds can also cause erectile dysfunction. So as long as the patient is not on a nitrate, in other words, they're not on nitroglycerin and they're not on isosorbide, Imdor is the trade name, those are nitrates. If they are, they cannot take these drugs. But as long as they're not on those, then they can take any of those 3 for, to help them with an erection. And what they would do is they can take it about 1 hour before sex, only once a day. That's it. And, if they have an erection that lasts for more than 4 hours, priapism, then they need to seek medical assistance. Okay. Then there's such a thing called a penile implant. I have had one patient with this. They implant a kind of like a weight thingamajiggy with a sleeve that goes inside the penis, like kind of over the urethra, but inside the penis. And then underneath the skin in the lower quadrant of the abdomen, all they have to do is kind of push and they can pump up this little penile implant to allow them to have an erection. So what won't we do? All right. Let's go over a couple questions. Let's get to the questions. Dun, 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 dun. The nurse is caring for a male client with complaints of frequency, urgency, and feeling that he can't empty his bladder. The nurse anticipates preparing the client for which procedure? It's the first thing we're going to do. If you said number 3, a digital rectal exam, you would have been correct. That's the first thing that we're going to do. And then probably blood work and then take it from there. Client has a diagnosis of benign prostatic hyperplasia and asks the doctor, what does he mean when he says watchful waiting? What response by the nurse is best? So I'll let you read those answers. And if you answered that you thought it was number 2, then you were correct, right? You report back on your symptoms. Okay, we're gonna watch and see what happens. Does it get worse? Does it stay the same? Okay, so do we need to intervene? And which assessment findings are expected in a man diagnosed with a variocele? Select all that apply. Remember, and that's fluid, fluid sac inside the scrotum. Okay. So scrotum is tender and red. Scrotum feels like a bag of worms, painless lump on the testicle, testicles tender, or the symptoms are worse when standing. Symptoms are worse when standing, absolutely, and the scrotum will feel like a bag of worms because of the fluid that's trapped inside. 28-year-old male reports to the nurse he's been having trouble maintaining an erection. Which assessment findings should the nurse further explore? His father had prostate cancer. He's had multiple sex partners over the last 5 years. He drinks a case of beer each weekend. He smokes 2 packs a day. Yeah, the beer. Alcohol is going to really put a damper on your sex life. And that's a good bit of alcohol for him to be drinking. So, all right, we're going to wrap this up. But really, the things that you need to know are the things that I've highlighted. And then there's some other additional fun information in there for you. And if you have questions, you know where to find me. And that's it for me. See ya.